If you're over 70 and your doctor just celebrated getting your blood pressure down to 120 over 80, you need to hear this. A study published in the Journal of the American Medical Association tracked 15,000 seniors for 5 years, and what they found contradicts everything we've been told about blood pressure targets. The seniors with so-called perfect blood pressure had a 28% higher risk of serious falls, and their mortality rates were actually worse than those with moderately higher numbers. In the next 15 minutes, I'm going to show you the exact blood pressure range associated with the longest survival in older adults, why the standard target might be dangerous after age 75, and the one simple test you can do at home tonight that could prevent a devastating fall. I'm Dr. Michael Kent, and this information could genuinely save your life or the life of someone you love. Before we go further, drop a comment right now with just your age. Just your age, nothing else. I want to see who's watching this because the information I'm about to share applies differently depending on whether you're 65, 75, or 85. And if you've ever felt dizzy when standing up from a chair or getting out of bed, add the word dizzy to your comment. This is critical information I need to see, and you'll understand why in about 3 minutes. Here's what's happening in doctors' offices across the country right now. A 78-year-old comes in for a checkup. Blood pressure reads 145 over 86. The doctor pulls up the standard guidelines on the computer screen, sees that target of less than 130 systolic, and immediately reaches for the prescription pad. One medication gets added, then another. Over the next 6 months, that blood pressure comes down beautifully, 124 over 78. The doctor is pleased. The patient gets a gold star on their chart. Everyone thinks this is a success story. But here's what the guidelines don't account for. That same 78-year-old now stands up to go to the bathroom at night, and their blood pressure drops from 124 over 78 down to 88 over 56 within seconds. Their brain isn't getting enough blood flow. The room spins, they reach for the wall but miss, and suddenly we're not talking about blood pressure numbers anymore. We're talking about a fractured hip, emergency surgery, 3 weeks in rehab, and a cascade of complications that too often ends in loss of independence or worse. The research published just months ago in JAMA Internal Medicine should have made headlines everywhere, but most doctors still haven't seen it. Most patients certainly haven't heard about it, and that gap between what the research shows and what's happening in everyday medical practice is costing lives. Here's the part that's going to sound counterintuitive, and I need you to stay with me because this is where everything changes. For decades, the mantra has been simple: lower blood pressure equals better health outcomes. And for middle-aged adults, people in their 40s and 50s, that's largely true. Getting blood pressure under control in midlife prevents heart attacks, strokes, and kidney disease down the road. The evidence is rock solid, but something fundamental changes after age 75. The research shows that seniors with systolic blood pressure between 130 and 145 actually live longer than those with pressure below 120. They have fewer falls, fewer fractures, fewer hospitalizations, and better cognitive function. The group that achieved that textbook perfect 120 over 80, they had higher rates of dizziness. Syncope, that's the medical term for fainting, acute kidney injury, and yes, higher mortality rates. Now, if you're someone who values understanding the why behind the numbers, not just being told what to do, then what I'm about to explain is going to give you a completely different framework for thinking about blood pressure management as you age. Your cardiovascular system at 75 is not just an older version of your cardiovascular system at 45. It's fundamentally different in ways that change what blood pressure numbers mean for your health. Let me explain the 3 critical changes that happen with aging and why these changes demand different blood pressure targets.